Hi, I'm Dr. BV Balachandra. I'm a consultant pediatrician and allergy asthma specialist, Chirayu Multispeciality Clinic.
Hi, I am Nityashri working in Chirayu Multispeciality Clinic, your allergy asthma assistant.
Today, we are going to discuss on how to give MDI with the spacer with the face mask. MDI with the spacer with the face mask is used in children less than 4 years of age. Sometimes older children who are unable to do a spacer directly keeping in the mouth. So for them also we might use a face mask. So this has got few parts, a transparent chamber and the face mask and the place where you can insert the medications. Now generally MDI, whenever you buy first time from the shop, you may have to let go 1 or 2 doses. First you will have to shake it vigorously and then let go 2 doses. Every time don't waste the medication. This is only for the first time, but every time whenever you are using it, you need to shake well at least 5 to 6 times. So once you are shaken well, keep the MDI into the spacer. Make sure that the way it is placed here is, this is on the top, this is on the top of it. Don't do the mistake of doing it like this. Okay, please always arrange it in such a way both are facing upwards. Now here Nitya will be helping us to understand how exactly to use it. So if a child can understand, please tell the child to breathe out before you keep the face mask. But if it's okay, if a child is not able to understand, that's still fine. So place the face mask and an MDI into the patient's face mask, covering the nose, mouth, chin, everywhere. Make sure there is no air leak. Press the canister. Okay. Ask the child to breathe in and breathe out through the mouth. This is very important, that to breathe in and breathe out through the mouth. When the child is breathing in and breathing out through the mouth, you can see that click sound is heard. This sound is very important. This is telling that the breath is going in and coming out in an efficient way. So whenever you are using a face mask with the spacer, child should breathe for 1 puff. The child should breathe at least for about 25 to 30 seconds. So once 25 to 30 seconds are completed, you may remove the face mask and the spacer. For a second dose, you need to disconnect the MDI, shake it very well, and then keep it again, okay, and then place it again into the face mask and then use it. Make sure that between the first dose and second dose there is at least 30 seconds or 1 minute gap you give it between first dose and the second dose. So similarly, if your doctors advise 3 doses or 4 doses, you may have to give a gap and then reinitiate, and each puff you need to breathe in and breathe out for 30 seconds, 1 minute gap, 30 seconds, 1 minute gap. So this is how it is done whenever you are using a face mask with the MDI. Few important things are, whenever you do this, preferably take a wet cloth, wipe the face, and if a child can understand, give some water and ask the goggle to spit out. If a child cannot understand, it's alright, give some clean water to drink it. How to take care of this instrument? Always make sure that wash it weekly once with a regular water with a gentle soap. If the soap is not there also, it's okay. Clean water, wash it. Don't use a cloth to wipe it. Hair dry it overnight and next day morning you can use it. Change the spacer once in 6 months, otherwise the medications gets adhered into the walls of the chamber. Please note, the effect of the medication is good only if you use it in a correct technique. If it is not used in a correct technique, the effect will be less. There are some situations where child is not cooperative or crying or anything. Please console the child. Give this MDI to the child so that child becomes friendly to that, and take as best as possible the cooperation of the child and then do it. Sometimes they may not keep for 25-30 seconds. If they are doing it for 10-15 seconds, it's all right. You may add on 1 or 2 doses, but don't worry much about it. Try your best to give the medication in a correct way. Thank you.
Thank you.